Welcome back, everybody. Time right now is 6:32. In August, Dr. Joey Stinson joined us. He's a vascular surgeon in Northeast Mississippi, practices at North Mississippi Medical Center. He was here to talk about you've got a pain in your leg and you don't know why. Well, one of the reasons may be because you've got a blockage in your leg. It could be in the form of a blood clot and you don't know what's going on. Well, his job is to go in and figure out why the flow is being blocked and what is blocking it. So let's talk briefly about that. Then we wanted to talk about, because you talked about it last time, but for those folks that missed it, talk about that. And then we want to talk about the different options people have to get rid of that.
Okay, thanks for having me back.
Sure.
Vascular disease is from smoking, high cholesterol genetics, can cause buildup of plaque within your arteries that prevent blood flow, which cause pain in your legs or wounds. That's essentially what we talked about last time. So we want to move into what can you do if you're diagnosed with peripheral arterial disease, and there's basically three categories. There's conservative management, which is diet, exercise, stopping smoking, medications, and then there's the minimally invasive options, which are your stenting, your angioplasty, which is a balloon inside the artery, and then atherectomy, which is a cutter that actually cleans out the inside of the artery. Those are outpatient procedures. And then ultimately you got your surgical procedures, which are your bypasses, which reroute the blood flow past the areas that are occluded or stenosed. And then your endarterectomies, which is actually open the artery up and you remove the plaque and build up and restore flow that way.
Let's talk. Last time, this really shocked me. The last time you were here and you talked about smoking and what it actually does. And for smokers out there, I know it's very difficult, but here's one more reason why you should just eliminate that from your existence.
Yeah, smoking is one of the top causes of peripheral vascular disease. You always hear about lung cancer and heart disease, but it actually does so many other things. And stopping smoking is the #1 thing you can do for your own health, including peripheral vascular disease. That's the mainstay of any of the other procedures I just mentioned. You have to stop smoking if you hope for these procedures to have good longevity.
You are one of a handful of vascular surgeons in Northeast Mississippi. How can people get a hold of you?
Yeah, you can call our clinic in Tupelo, Starkville for an appointment, and we can get that number, I think.
377-7170. If you've got some pain in your leg, you're wondering what's going on, you don't want to let it go to the point where there's a removal of a limb.
The sooner you get to us or your primary care provider, the better your options.
Dr. Joey, thanks so much for coming by.
Thank you.
Really good to talk to you, and thanks for the information.
Thank you.
Time